Good afternoon, everyone, and welcome to the Cleveland Museum of Natural History's newest online phenomenon, Science in the News, a program that we hope might go viral. Yeah, that's a bad pun. I'm Lee Gambol. I'm in charge of video conferencing and distance learning here at the museum. And today we've welcomed Dr. Nicole Burt. I'm going to use your whole title and be very official. You ready? I'm even going to read it. She is our Curator of Human Health and Evolutionary Medicine here at the museum. I bet you some of the folks watching didn't even know that we study human health and evolutionary medicine. That's awesome already. May I give you a elbow bump in celebration of that? Excellent.
Safety.
Very well. Thank you for joining us today. And today's discussionary topic, I think most of our viewers are probably well aware that we've got a little virus out there causing some challenges. And at the museum, because we do study the whole process of us becoming human and all of the health issues that we have faced throughout the millennia, now is a great time to talk about it.
Right.
So to start off the conversation, shall we just simply define for our viewers, what are we looking at here today?
Yeah, so I think the words that are going around can be confusing for people, right? So there's the disease itself, so that's your COVID-19 designation. There's also the SARS coronavirus
-CoV-2, yeah, that one.
which is the actual name of the virus, which is, again, they have those kind of intense names just so that people researching and doing public health know how they're related, right? Because viruses, like everything else, evolve and change, so you need to be really precise in how you're talking about them. Coronaviruses in general are named because they look like a crown, so it sounds really nice, right?
It does.
But
very fancy.
so coronaviruses are one of the major genera of viruses. They're very common, so there are tons of different coronaviruses. We have encountered them before, even though this one in particular is new. Common colds can be coronaviruses. So
okay, so what I'm distilling from that is if I said SARS-CoV-2, that's kind of like saying H1N1 when you're talking about the flu.
Exactly.
It's a specific name of one specific virus in many, many, many of them that all fall into that category.
Right.
Because I had seen some little tidbits about, a dog might have tested positive, or can I get it from my pets? And part of my background is veterinary medicine, and I know that there are definitely coronaviruses that caused illness in pets. Often it was more intestinal than the upper respiratory. But that's good to know that we have faced this before. It is something that our species has definitely handled.
Yeah, so we have a long history with viruses. So viruses have definitely had an effect on our evolutionary trajectory and continue to do so because viruses are really hard to counteract. Unless you have a vaccine, you don't have a lot of options other than washing your hands, don't cough on people, stay home if you're sick, the basics that everyone's hearing. That's really the main way we deal with it. And what's also interesting about zoonotic diseases like this, which can be in non-human animals or humans, is that they do jump back and forth, and that is partially shows how closely related everything on Earth is, right? And why it's important to think not just of humans when we talk about health, but our wider environment, other animals, our relationship, evolutionary histories. All of this is part of understanding the science and making a good approach to outbreaks like this.
Sure, remembering that humans are part of the natural world, and it's normal for us to be exposed to each other and other animals. We have agriculture, we like food, so this process is us learning, which viruses are more likely to cross over from different species. Oh, excellent. And this particular virus, do we have a handle on where we think it emerged from, or an animal that it might have been?
There's still a lot of speculation on this. A lot of these viruses, when they jump, they're coming from like bushmeat or live markets or things like this. So that's one of the things to be careful of. There is a difference between like domesticated food animals, bush animals, and then like pet animals, like companion animals. All of those have very different relationships with humans. And of course, if the animals themselves are living in tight confines, that's going to change how diseases evolve and develop in those animals compared to your cat living alone in your house and not with other cats.
Well, that makes sense with people too, because we're being told the whole idea of a group of humans all in close confines just increases the possibility for that virus to move around between those individuals. Excellent. Now, I have a little bit of a, you might be able to hear it, folks. I'm trying not to sneeze on Dr. Burt while we're here today, but I'm dealing with a wonderful upper respiratory and sinus infection, so, all that grossness going on. I apologize in advance if I cough during this interview. I will cough the right way. But this particular virus has some pretty particular symptoms, because I know that when you just say, hey, stay home if you're sick, well, there's a lot of ways you could be sick. So could you define for us what this particular virus is causing?
So what we know right now is that for coronavirus, you generally have fever, associated fatigue, and then a dry cough, which is different than like a producing juicy cough.
A juicy cough. Write that down, folks. Juicy cough.
So a dry cough. But one of the things you want to really be concerned with, and you should always be concerned about this, if you have shortness of breath or difficulty breathing, and that often sounds like you would be gasping for air, but it often can be like a heaviness or a difficulty breathing can be a little bit broader than just like I can't breathe in that moment. It's not necessarily like having an asthma attack. Difficulty breathing. And if you have difficulty breathing, you should definitely seek medical attention no matter what, whether you think you are likely to have COVID-19 or not.
Right.
That is just the right thing to do in that case. And I think that's one thing to put out there, that one of the things in terms of public health, we always want to be cautious if we're ill, not just spread things, right? So be conscientious, and you never know if, someone else might, they might not be obviously at higher risk. For instance, older, right? Because older individuals are more at risk both of flu complications and COVID-19 complications, but they might be immunocompromised or something, and you can't see that in a person. So part of being a good citizen in the world and in terms of public health outcomes is to take these actions and make sure we're not putting other people at risk when we don't have to. That's why we get vaccinated. That's why you stay home when you're not when you have symptoms and things like this, is to take care of yourself, but also help our communities, because these types of social distancing, as I talk about, good for people who already want to be socially distant, but social distancing activities, limiting those large groups, really are proven to slow down the transmission of diseases. So we know that it works.
Again, that whole grouping idea, if you have a whole bunch of animals all breathing the same air, and you've got something that is airborne, makes it easier to transmit. Do you mind if I toss in one little tidbit, since you were talking about describing lungs? I'm going to ask my camera guy, Matt Crow, to do something he wasn't expecting. Matt, by your left hand, there's a big blue sponge. Could you throw that at me?
Thanks, camera guy.
Sponge is flying. This is one of my props that I use to show little kiddos. And now, hey, all of our Facebook viewers and everybody else who's watching, the idea of what your lungs are actually like on the inside. Because you have a trachea, this windpipe, that branches into two big branches, and then lots of little branches. But all of those little branches terminate into these little tiny holes that we call alveoli. And it's like a sponge. And when you exhale, the air is being squished out of all those holes, right? And then whoop, inhaling back in. So if these little tiny holes are being infected with bacteria or a virus that is causing a lot of mucus to be produced, that's where your wet cough comes from. You're coughing it out of there, right? Or the tubes. But in this case, we're not producing a whole lot of mucus in here. So when you say a dry cough, it's just air coming out of your lungs. Thank you, Matt, for throwing the sponge at me. Excellent. What about breathing? Well, I've seen a lot of folks, here at the museum, just around town, wearing face masks. Is that helpful? Is that not helpful?
So that's a really interesting question, because if you have a cough and you do have to be in public, a face mask is not a bad idea to contain that, right? Because it keeps you from ejecting.
If you have the cough, you're not sharing it.
You're not sharing it, right? So it's keeping it in. It's not necessarily going to help you not get in contact with anything, because one of the fastest ways to do it, and why we keep bringing up hand washing, is that you put your grubby little hands on everything and then you touch your face. And I think what I've seen just tons going around is everybody realizing how much they touch things.
What are you talking about?
in their daily life. And so it's really hard not to touch your face. And if you have stuff on your face like we do, glasses, you're going to be touching your face. You should be washing your glasses, right? Because that's also something.
Oh my gosh, I never thought of that.
You're going to be touching.
Oh.
That you're going to be touching. Great. It's the same thing with, like, if you have a face mask and you're not sick, you're probably also going to be tempted to adjust it, to touch it, in which case you're just increasing the amount of times you're touching your face, which we don't want. And by the way, I'm not touching my face. I'm touching near my face.
I did.
And I should say, in terms of hand washing, I know people have heard that a lot, and they hear like 20 seconds, sing yourself a song. Most TV jingles are like 20 seconds, so
Everything's better.
you can share it up, but like make sure you're actually getting your fingertips.
Yeah.
Because that's what you're touching things with. So you need to wash your fingertips. Not just
What
this isn't
fingernails
washing your hands.
too, right?
Yes.
When we do dissections here at the museum, I tell the kids, look at your fingernails, guys. When you're washing your hands, kind of do a little little scrapey, get some of that sudsiness under there. Absolutely. So serious hand washing, not just a little I'm done and out of there.
Exactly.
And when it comes to, okay, darn, I don't have a sink, and I know I just touched my face or I sneezed or whatever, but I have this hand sanitizer. What's the best kind of hand sanitizer to be using?
So you do need sanitizer with alcohol, because that's actually going to be what explodes the cell wall, right, and kills it. Though we're very lucky in that COVID-19 is actually pretty easy to kill. It's not a particularly robust cell in terms of breaking it down. So that's good. But yeah, so make sure that you're actually using alcohol-based sanitizer, letting it evaporate on your skin. Like, don't wash it, like you need to let it evaporate for it to work. And just remember that it's great that we have those products, and it's great that you're cleaning surfaces and all of this. That's really important. But you can also just use normal cleaning products to clean your surfaces, not just like disposable wipes. You can clean it with other things. And of course, regular soap and water is really kind of the gold standard in public health. That's why doctors still are washing up before they do things as well. And I just want to take a second too, before I forget, to mention that one of the things that's, people are like, why are we talking about this so much now? And it's not that we didn't know that this could happen, like as scientists. It's not that we didn't know that novel diseases come through, but like I said, we're trying to get ahead of it, right? Which is a big public health concern, and we don't have that vaccine yet, right? So we have vaccines for the flu, which can provide a herd immunity and make sure that you can get protected with your antibodies produced when you didn't get the disease, which is a huge way of fighting viruses is vaccines. And since we don't have that in our arsenal yet, it's a little bit scarier in terms of the medical establishment might get flooded with people who need some sort of assistance. Most people get mild cases, right? Most people are not needing hospitalization. Most people are not dying. But what we're trying to do is making sure we're not overwhelming our healthcare systems as well.
Right. And that's where the term self-quarantine comes in, where if you know you've been exposed, you've been told, or you suspect, if you are choosing to remain away from the herd. I like using the term herd because
herd immunity is great.
We herd children through the building all the time, and you have a fun little. Let's show the graphic. I like this very much.
Yeah,
this term herd immunity. Do you mind doing a quick
so herd immunity, it's just really a way to describe how vaccines help, right? So in populations that no one's been immunized, if you have unhealthy people or people who could potentially spread a disease go into it, it's just going to spread through that population quickly and easily, right? Because everybody essentially is, again, naive to the virus. They'll get it. And it takes your immune system a little while to figure out what's happening, so they would get pretty sick. Well, if you have most people or a lot of people being vaccinated, they essentially act as like a shield from transmission. So if the one sick person is only contacting people who are vaccinated, it's not going to spread. And so it's a really good way of containing things.
Man, I think that's the best way ever to get some little kiddo who doesn't want to get a shot. It's like, dude, you're going to be the shield, like Captain America's shield.
Exactly.
I love that. I love that. Currently, our social media manager, Samantha Gunther, has showed me we have a question. Yes, ma'am.
How long until we can expect a vaccine to you guys?
So vaccines take a while to produce. I don't know what the absolute current estimation is. We have a lot of people globally working on this. So we will have a vaccine. This is what, we do this normally. Probably not in terms of this particular outbreak will we come, that's why we're doing the distancing, right? It's not going to be here tomorrow. However, it is coming, right? But again, partially that means when we have the vaccine, people have to get it. Just like we have a flu vaccine, you have to get it for it to work, right? Because there's actually enough people have to have it.
Excellent. Since you mentioned about this herd immunity, would you mind, there's a term that epidemic versus pandemic.
Right.
I have a bunch of classes I teach where we go even the smallest outbreak. Do you mind if we wrap it up on just defining that so folks know what we mean by those terms?
Yeah, so epidemics are just unusual spikes in disease prevalence locally, and then an pandemic means that spike is happening in a wider geographic area, right? So it's happening around the globe. It doesn't necessarily mean more people are dying of it. It just means more people are getting it.
Gotcha.
And that's that spread. And so we do need to be ahead of it, but that doesn't necessarily mean that it's any more deadly than any other.
But it would affect how you handle
Correct. Your
treating
response.
it,
Yes.
or your response to it, right?
Because you really need to mitigate, right? Because we just don't want it to keep spreading.
Gotcha. Excellent. Thank you so much. Wait, does that mean one more question? Oh, yes, Samantha.
Mystic would like to know when there will be a medication to take. So very similar to our vaccine question.
So viruses are not bacteria, so antibiotics will not and will never work on it. Vaccines are going to be our number one defense against this in the future. Sometimes there are specific antiviral medications for like extreme cases that can reduce symptoms, but for the most part, they aren't going to treat anything. Just like when you have a cold or flu, you pretty much have to put up with it until it passes.
There was an episode of ER, if anybody remembers that show from a million years ago, where there were a whole bunch of people in the lobby, and they thought the doctors were pretty sure they all had the flu.
Right.
And one of them went out there and just was like, "Go home! Antibiotics, you're not going to get them because they don't work." I loved it. I was like, "Yes, that's awesome." So don't use the antibiotics for a virus, folks. It just doesn't work because a bacteria has a very different membrane.
Correct.
It's a living organism on its own, and those antibiotics disrupt its life functions.
Correct.
But a virus is a weird little chunk of
But we don't want to go down there. That's a whole.
nuts,
That's a
man.
whole.
That's
a whole
another
other
episode,
thing.
man. Well, yeah, they're not. Viruses are just weird, man.
Yeah, they are.
Man, well, this was a wonderful condensed version of a Science in the News, folks. There's going to be more because we like to stay on top of things and also throw the natural history angle on there because we're just parts of a greater whole that is the planet. So, Dr. Nikki Burt, thank you so much for joining us. One more elbow bump.
Elbow bump.
Ta-da. Folks, thanks for joining us, and stay tuned. There will be more Science in the News. From the Cleveland Museum of Natural History, I'm Gambol. Dr. Nikki Burt, thanks for joining us.
Thank you.